So the big topic at the moment is regarding the COVID jab, and the survey's been done saying that people from the Black, Asian and minority ethnic background were unlikely to accept the COVID vaccine. Tonight we're talking to Dr. Marla Ubhi. Welcome to Community Link Show.
Thank you.
I know you wear different hats, so would you like to tell us for this evening's show which hat you're wearing?
My name's Dr. Marla Ubhi, and I'm a Cheltenham GP, and I'm also part of Gloucestershire's clinical commissioning group working towards vaccine equity across Gloucestershire.
Okay. So I'd like to start by saying there's so much going on regarding the Black and minority ethnic people not taking up with the jab. Now, like myself, you are from an ethnic background.
Yes.
However, for me as a Caribbean, what I do note going in the media is a lot of Asian actors, people of celebrity, more than Afro-Caribbean. I don't know if you can answer this, but do you know why that is?
I don't know if I can answer that specifically, but I do hear what you're saying, that there's been some media campaigns by a range of people from Black and minority ethnic backgrounds, and not all of those backgrounds have been represented equally in the media. I do think it would be really powerful if people from all walks of life are able to speak to people about having the vaccine, and that it's been thoroughly tested and it is safe for everybody to take up that offer when they get the offer of the vaccine. I think it's really important, Carol, that when people see individuals from backgrounds that are the same as theirs, it's really, really powerful, and it makes people feel supported in their decision making. So you touch on a good point, really, that it would be great to have community, faith leaders, celebrities, anyone from across the country endorsing the vaccine in a way that is reachable for all these different communities.
Because for me, that's one of the things, is do they look like me? It's like we have adverts for hair products, and if the person don't look like me, then I think that hair product isn't for me. Yeah,
I absolutely hear you. I'm a British Indian. I was born in Birmingham. And I do hear you, that you want to feel that you're represented, that people understand your point of view. And one way that people may understand your point of view is that they have lived experience, they're from similar backgrounds as you. So I think that's a really powerful way of communicating with people.
Right. I've got some questions from people from mainly the Caribbean community. So let's kick off with this one from Annette.
Where do I stand with having allergies and hearing what's going on? Which injection would be best for me?
And what age group category do you come under, Annette?
I'm 60.
Okay, so there's a few things I must mention here, that when people are called to be vaccinated, it's really important that if they have an allergy, they should speak to their GP to make sure that they get the right advice for them. The vaccines are safe and effective for the vast majority of people, and they have been tested on tens of thousands of people and assessed by experts. Any person with a history of allergies to the ingredients inside the vaccines should not receive them. So there are lists of what's in each vaccine, and that's available on the government website. Equally, you can speak to your GP, who will be able to have access to that information. But it's really important that if you do have allergies, you discuss it with your GP, who will be able to advise you. And lots of people with allergies are able to have these vaccines safely, but a discussion absolutely has to be had.
So this is a part of the confusion, isn't it? Because on one hand, people who have allergies are told they can't have it. And so I had a question was saying, well, why is the vaccine not safe for people who have allergies? But from what you're saying, what you've just said, in some cases, even though you have allergies, it's still safe.
It's really hard to understand this information, because if you do have an allergy, you may be more worried whether you can take the vaccine. However, there are very strict reasons why you can't have it, and being allergic to the ingredients that are in the vaccine is one of them. If you've had an allergic reaction to a previous dose of that vaccine, you can't have it. And so there are specific allergies. I know that I've had people ask me, well, I have hay fever. Am I allowed to have the vaccine? That's a sort of allergy. Well, yes, people with hay fever can have the vaccine. So I agree that it is a little bit confusing. So you don't have to make that decision on your own. Instead, just ask your GP or your practice nurse, who will be only too happy to help you and guide you through that. Because you're right, most people can have the vaccination, and having the people who are vaccinating you are also trained in being able to deal with allergic reactions in case they do happen, and that's a central part of their training.
Right, so my next question then comes to Dawn.
So you have a question for the Dr. Dawn?
The Pfizer vaccine, they say that you shouldn't have it done for 3 specific reasons. If you're allergic to medicine, if you have an allergic reaction to food, and the third one, which I can't remember what the third one is, does the same apply to the Oxford vaccine?
Okay, thank you.
Thank you for the question. With all the allergies, the best thing to do would be to speak to your GP, who will understand your allergies and will be best placed to advise whether either of those vaccines, the ones that are mentioned, the Pfizer or the AstraZeneca one, would be safe and appropriate for you. So I think that would be the absolute safest thing to do if you're not sure.
Okay. The next one I have is from one of the local bishops.
Yep.
I would want to know if I take the vaccine, will I be able to stop wearing the mask? Can I go to restaurants or wherever without wearing a mask? Will I be resistant to COVID? Why would I want to be wearing the mask now that I've got the vaccine? I'm supposed to be protected. All of those questions. Do I have to stop social distancing? I've got the vaccine and it's supposed to be that good. Can I go to cinemas and all them places? All them things I would want to know.
Thank you for the question. I appreciate that the lockdowns make life really tough for people, and many people may be wondering the same thing, whether if they have the vaccination, can they change their behaviours in society? I'm afraid to still protect yourself and your family and your friends and colleagues, you absolutely still need to practice social distancing, wear a face mask, wash your hands carefully and frequently, and follow the current guidance. So we know that the vaccine cannot give you COVID-19 infection, and a full course of the vaccine will reduce your chance of becoming seriously ill. What we don't yet know is whether it will stop you catching and passing on the virus, but we do expect it to reduce this risk. So it is still really important that everyone follows the guidance in your area to protect those around you. So to protect yourself and your family, your friends and your colleagues, you absolutely still need to practice social distancing, wear a face mask, wash your hands carefully and frequently, and follow the current guidance.
At the beginning of the show, I played clips from people against the vaccine. And something that someone said was, when you've been in contact with COVID or you have COVID, you're told to self-isolate for 10 or 14 days, but no medication is mentioned. So why do I need to take the jab?
So we would recommend taking the vaccine because taking the full course of a vaccine reduces your chance of becoming seriously ill. So for some people, they're able to self-isolate when they do have COVID-19 and they get better, and that's the majority of people. But for some people, as we know, especially from Black and minority ethnic backgrounds, they could become seriously ill. And so it's really important to take up the offer of the vaccine, because you don't know that when you get COVID-19, hopefully you won't, but if you should get COVID-19, whether you would be somebody who has it mildly or whether you have it in a life-threatening way. And having that vaccine reduces that risk of you becoming seriously ill.
You know, at the moment, there's so many on the market now, all of a sudden, there's different vaccines. Do we get a choice in which one we get?
The vaccines that have been approved by the MHRA, the Medicines and Healthcare Products Regulatory Agency, are the ones that are available for us here in England. And at the moment, those two are the Pfizer vaccine and the AstraZeneca vaccine. So people won't be able to have a free choice as to which vaccine they can have.
So it's recently been confirmed that pregnant women can now have the vaccine. What has changed so quickly, and how safe is it for women to have the vaccine who are planning on starting a family?
I think it's really important for people who are pregnant or planning to become pregnant to speak to their GPs about their individual circumstances. My understanding is that if you are a high-risk patient who is pregnant, and high risk may include things in your medical history or personal history, then the vaccine may be appropriate for you. So really, it has to be done on an individual risk basis, which involves a conversation with a clinical person, either your practice nurse or your GP, who can guide you through that risk benefit analysis, really, that's particular for you.
So it's a bit like the allergies, what you said earlier about allergies.
Absolutely. So really the main message is don't just stop yourself from having the vaccine because you haven't got enough information. If you're unsure and you need more information, whether it's about allergies, whether you're in the right cohort to have the vaccination, don't use that as a reason not to have it, please. Instead, speak to someone who might be able to help you. And GPs are best placed who know you, know your history, know your allergies, and they'll be able to advise you whether having the vaccine will be safe for you.
So one of the worries people have is the quickness of this vaccine. So how have they measured the long-term side effects?
I hear that a lot as well, that people are concerned that it's been so speedy. And some people say that it takes many, many years to formulate a vaccine out and put it out to the public, whereas this has been very rapid. And I suppose in answering your question, it would be useful to understand why it's been so quick. There has been absolutely no shortcuts. So the vaccine that's approved for use in the UK, they have met strict standards of safety, quality and effectiveness as set out by the Independent Medicines and Healthcare Products Regulatory Agency, the MHRA. And this agency follows international standards of safety. So any coronavirus vaccine that is approved must go through all the clinical trials and safety checks that all other licensed medicines go through. Also is important to mention is that these trials, the Pfizer trials and the Oxford AstraZeneca trials, have involved people from Black, Asian and minority ethnic communities. And there's no evidence that either of the vaccines will work differently in different ethnic groups. So the fact is that even though it's been developed quicker, there's been no shortcuts at all in getting these vaccines out. The reason they've been quicker, well, there's a number of different enablers that have made this groundbreaking medical advancement possible. The different phases of the clinical trials were delivered to overlap instead of running sequentially, so that sped up the clinical process. There was also a rolling assessment of the data packages as soon as they were available, so experts at the MHRA could review as the trial was being delivered, so they could ask questions along the way and request extra information as needed, as opposed to getting all that information at the end of a trial. And also clinical trials managed to recruit people really quickly because there was this global effort. So that meant that thousands of people were willing to volunteer. And a mix of all those reasons is why this process has been speedier. So even though it's been quicker, there have been no shortcuts taken.
Now, we've been COVID been around a year now. And so if someone, and we've seen the figures on the news, a lot of people have had COVID, a lot of people have died from COVID. So if someone has had COVID, what is the point in having the vaccine if it's not going to stop them from catching it again?
It's really important to still take up the offer of having a vaccine. We know that there are different strains and the COVID-19 infection has changed. We also don't know how protected you are from having COVID-19 infection. what we do know is that these vaccines have been highly tested, and if you have a full course of this vaccine, they will reduce the chance of you becoming seriously ill. So I think it's really important that even if you've had COVID infection or you think you've had it, it's still important you have the vaccine.
Right, we'll go to the community again. Pastor Crawford has a question.
Doctor, my question is this, and before I ask my question, I'd like to make it clear that I am not anti-vaccine. I've had several vaccines in my lifetime because of my travels across the continent of Africa. But how do we trust you when people of African Caribbean background have been so tricked many times by the established institutions of this country? And I want to expand it. Europeans. We have evidence of the trials where African men were injected with untreated syphilis. We also have recently when your medical colleagues in France made the statement that the vaccine should be tried on Africans, even though there's every evidence that the pandemic is not taking the amount of lives on the African continent that is happening here in Europe. What can you say to us that will inspire some confidence in what you want to achieve? And why isn't the government and the health system spending enough money to take care of some of the inequalities that Black people suffer? Thank you.
Thank you for the question, which covers quite a lot of different challenging concepts, really. It's always hard to trust in a situation where there's so much historical mistrust, which you've very clearly articulated in your question. What I can do to reassure people is to say that these vaccines have met strict standards of safety, quality, effectiveness. There have been no shortcuts in the clinical trials. The proper process has been followed for these vaccines to be available to the general public. Both of the vaccines, the Pfizer and the AstraZeneca trials, involved participants from Black, Asian and minority ethnic communities. And so people from these communities have been represented in the trial data. I think it's also really important that community leaders and celebrities and people in positions of influence are able to put forward their positive views about the vaccine. And that contributes to trust, that when you see and hear somebody who looks like you, who's lived a similar life to you, that message is really powerful. So I think we discussed this a bit earlier on in the interview, how important clear communications are. And I think it's critical, really, is the answer. So please don't avoid having the vaccine because you haven't got the right information, or you don't have enough information, or you're not sure about something, because there are amazing sources of information that you can get online through the Gov website, and equally in person by talking to your GP or a practice nurse about what's right for you. And hopefully they will be able to talk through the things that are worrying you and enable you to safely have that vaccine and make an informed decision that it's the right thing to do for you.
I know you say there about, celebrities and that, but one of the things that I was asked to ask you is, why is there so much mistrust even from frontline Black NHS staff, doctors and nurses, in refusing to take the jab? Because even this morning I heard on the news that care home, the range staff at a care home wasn't taking the jab. So that doesn't, reflect back into the community, does it?
I must say I haven't seen the data that supports that, but I do understand your line of questioning, that you feel that a visible uptake from Black and minority healthcare workers would feel reassuring for the rest of the community. And I agree with you on that. And as part of the COVID vaccine equity group, we're working really hard to understand why certain communities across Gloucestershire are feeling positive or negative towards the vaccine. And we're trying to give accurate, reliable information so that people can make informed decisions about their health and well-being. The worst situation is people make a life-critical decision based on misinformation, lies, or incorrect information. And that would be incredibly sad and could potentially cause them harm. So one of our motivations is getting out accurate, reliable data so that we can help support people make those decisions. I've had my vaccine. You know, as a healthcare professional, I've obviously agreed and I've had it.
Okay. Talking about temperatures, we're still taking temperatures when everyone is different. Not everyone who contracts the virus has a high temperature.
I think that one thing we have learned from COVID-19 is that there are wide-ranging presentations. What I mean by that is that people can present quite differently with symptoms of the infection, but 3 critical things we know about: having a continuous cough, a loss or change in your taste or smell, or having a high fever certainly means that you need to call 119 or go online and access a swab and self-isolate in line with the government advice.
Another question from the committee from Mr. Saunders. Now, Mr. Saunders actually had in the care service, so he's actually had the vaccine.
It is said that, you know, Black people and more or less BME, Black and Asian people seem to be affected more than anything else. I'm wondering if there are any particular symptoms that you will see or after effects that will be more evident in Black people than other people groups. Okay. For example, my headache would it show up is there something specific that, you know, Black and Asian people would be having, or is it, you know, we've been as man, so to speak, or mankind, we'd all be experiencing the same after effects. Yeah.
So there's clear evidence that COVID-19 does not affect all population groups equally. Many analyses have shown that older age, ethnicity, male sex and geographical area, for example, are associated with the risk of getting the infection being higher and experiencing more severe symptoms. And this work is being commissioned by the Chief Medical Officer for England to fully understand the extent that ethnicity impacts upon risks and outcomes. So these complex associations are being investigated on a national level. The vaccines have been tested on volunteers from all ethnicities and age groups to ensure that they're safe and effective for Black and minority ethnic people as much for anyone else. And there is no evidence that either of the vaccines will work differently in different ethnic groups. I think, you know, if you have concerns that you need to talk through with a healthcare professional who knows you and knows your family, the best person to do that with is your GP or your GP surgery, because they'll be able to talk to you in a way that hopefully can reassure you based on all that information they already know about you and your personal medical history.
Now, I've got a couple of questions around employment. I'm not sure if you can answer these, because obviously it's like, can an employer force an employee to have a vaccine? Are companies within their rights to withhold certain benefits if an employee don't want the vaccine, like promotion, etc.? Is it right that some employers want their employees to write to their MPs to bump themselves up the list to receive the vaccine? I'm not sure if you can...
Well, thank you to everyone for their questions. But I'm afraid, Carol, you're probably right that you probably need a legal brain to be talking about this rather than me. So apologies. I think it's probably a question for a legal expert, if that's all right.
That's what, come back to me then. I need to go and find someone.
That's it. Absolutely. Thanks, Carol.
Right. Last question. She's not just like a comment more than a question, but I just wanted you to hear from and this person is in, I think she's early 40s. So I tried to get right across the board age-wise.
Great, thanks.
Hello. Firstly, I'd just like to say that I'm not an anti-vaxxer. I've had all of my vaccinations, and I'm not anti-vaccinations, but I am concerned with this one simply because of the pace of production. I know it's been said that this has been a world-class effort, and that because of its global nature, you've been able to test on various people, and there have been various sites. However, usually vaccinations take 10 to 15 years to produce, so this is significantly shorter because it's taken less than a year. And also this issue of side effects. Now, people can say what they want about the side effects and say X, Y, and Z. The key thing which cannot be negated is that we don't actually know. Because there hasn't been a lengthened period to say, or extended period to have a proper examination of what the side effects are, we do not know. And that is my main reason for not taking it, because only time will tell what those side effects are. And so that's the reason for me.
I think I understand the question, and I think some of what we've covered already today explains why this process was so speedy. Nothing has been compromised in terms of safety. The NHS will not offer any COVID-19 vaccinations to the public until the experts have signed off that it's safe to do so. And the MHRA, the official UK regulator, have said the vaccines in use are safe and highly effective. And so we have full confidence in their expert judgments and processes. My overall message is, don't just say no because you don't know enough. If you don't know enough, ask somebody who can help you. That's my message.
Right. Well, I need to thank you for sparing some time. I know you're a busy person. And obviously, there are probably still more questions coming in. But what I will do, if that's all right with you, is email them on to you, and then obviously come back to whoever was emailed in, because I know you need to go now.
Thank you so much for having me, and thank you everybody for asking the questions that I'm sure a lot of people want answers to, and I hope I've managed to answer some of them today. Thank you, Carol.
Thank you.